Hi, I'm Naomi Damon. I'm one of the clinical specialist physios that works at the Leicester Royal Infirmary. We've put together a short summary of the services that we offer at the Leicester Children's Hospitals, and we're going to discuss the physiotherapy and occupational therapy services that we provide here.
The Paediatric therapy team aims to provide fully integrated, high-quality care to children from birth through to adolescent years. We cover the entire Children's Hospital, including A&E and the neonatal unit, as well as regularly participating in specialist clinics, including long-term ventilation and cystic fibrosis. Our typical caseload includes the oncology ward, general medical wards, surgical wards, orthopaedic wards, as well as high dependency and intensive care units. We also work closely alongside our occupational therapy colleagues to promote function and mobility in patients who are following orthopaedic surgery and those who suffer from neurological deficits. For any therapy equipment or advice essential for home, we issue this to parents and carers prior to discharge. For those who require further therapy support, we liaise with community and outpatient providers locally and cross-county to ensure that the child's needs are best met by the appropriate service. If you would like to refer a patient between the hours of 8:30 and 4:30, to contact the physiotherapists, please bleep 7052, and to contact the occupational therapists, please bleep 5363. Alternatively, for any non-urgent referrals or queries, please leave a message on extension 5714. We run a dedicated 7-day service for all of our respiratory patients, and for any children who are deteriorating overnight and may require chest physio, you can contact them via switchboard, and they may take up to 45 minutes to arrive from home.
Paediatric Outpatients is located at the Leicester Royal Infirmary. We see a variety of patients with respiratory conditions, musculoskeletal and persistent pain problems. So if you want to get in contact with us, you can refer through with these green cards you can find on any of the wards. If you can't find one of these cards, if you send through a discharge letter with an appropriate reason for why you're referring, or you can get in contact with us through your general practitioner and refer straight through on our fax number 0116 258 6193. We also have additional services. We have hydrotherapy run at the General Hospital on a Tuesday from 2 until 4:30, and we have a gym class right here in the gym across the way, run from Thursday 3:30 till 4:30. So in terms of what to expect when you come here for a physiotherapy appointment, you'll be seen in one of these cubicles, and you can bring your parents, or if you do want to be seen alone, you can get them to fill out a consent form. So when you first come in, what we want to know are a few basic details just about you and where your doctor's is so we can check you're the right person. And then we'll have a look at what your problem is. So we'll spend about 10 to 15 minutes talking through your problems. You can tell us exactly when it started, if there's anything else that might be linked. Then we'll go through a few different tests, so looking at how you move, if you have any differences to your friends or your siblings. And then we'll have a look at some treatments, so some things you can do at home with your parents or your friends that we can make fun as well.
We focus on interventions involving participation in activities of daily living and possible equipment provision for home. Some of our children require rehabilitation or input to progress their developmental skills. This can involve looking at seating options, postural management and manual handling. To enable discharge home, we may offer you some equipment to help with transfers. This can include hoists or banana boards, and we may also give you some equipment such as a commode to help with toileting. Some of our children require support with their developmental input. We can offer them some seating such as tumble forms, and this can help with their core strength and increase their sitting tolerance. For some of our older children, they may require static seating to help with their posture. We have a small stock of wheelchairs and buggies that we can provide to children on short-term loan. This is dependent on need and as our stock allows.
We look forward to working with you, putting children at the heart of our care.